This is a hospital bill, $42,000 for a surgery that took less than an hour. Ask the surgeon what it costs. She doesn't know. Ask the hospital. They'll say, it depends who's asking. Ask the insurer. They'll say the real price is confidential. Nobody in the building can tell you what the thing that just happened to you costs. And it's not just this bill. The same scan in the same city on the same machine can cost 5 times more on one side of town than the other, and almost nobody notices. All of it adds up to about $5 trillion a year. Americans now spend more on healthcare than the entire economy of Japan. So, we go hunting for a villain. The hospitals blame the insurers blame the drug companies blame the middlemen. Everyone blames everyone, and the bill goes up anyway. What if none of them can explain it alone? What if the answer isn't hiding in any of these buildings, but underneath them? Because there's something down there, something enormous, and to see it, we're going to do the one thing a patient never gets to do. Follow the money. 1955, a doctor's office on a main street. You get treated, you open your wallet, and the money travels 3 feet, from your hand to his. That's the entire machine, a patient, a doctor, a pharmacist, 3 parts. You could see all of it without turning your head. And in 1960, that's still roughly how it worked. More than half of every dollar America spent on healthcare went directly from the patient to the people providing the care. Then came the accident, and it had nothing to do with the medicine. During World War II, the government froze wages. Companies desperate for workers couldn't offer more pay. So they offered something else. Health insurance. And the taxman made a fateful ruling. Those benefits wouldn't count as income. Suddenly, $1 of insurance was worth more than $1 of salary. Health coverage fused to employment, and a third party quietly stepped between you and your doctor. Someone else would carry the money now. It seemed like a gift. In many ways it was. Nobody wants to hand over a life's savings for a surgery. But watch what just happened mechanically. The money no longer travels 3 feet. It travels through an organization, and an organization can't just hand money over. It needs rules for what it pays, proof of what happened, forms, reviewers, a system. The moment money stops traveling 3 feet, it needs a machine to carry it. And machines that carry money have a way of growing. In 1965, the government itself becomes a payer. Medicare for the elderly, Medicaid for the poor, and overnight, the biggest customer in American healthcare is an institution. Insurers multiply to serve the employers. And now the machine hits a problem nobody anticipated. Translation. A doctor speaks medicine, a payer speaks money. For one to pay the other, every human ailment has to be converted into something a bureaucracy can process, a code. Today, there are around 70,000 diagnosis codes. There is a code for being struck by a duck. There is a code for being burned when your water skis catch fire. This sounds absurd until you realize each code exists because somewhere a payment depended on it, and codes need coders, claims need processors. Between the providers and the payers grow whole new organs, billing departments, clearinghouses that sort millions of claims like mail, networks that negotiate secret prices, benefit managers who stand between the pharmacy and the insurer. Step back and look at what the machine has become. Pipes carrying money in one direction, pipes carrying paperwork in the other. And here's the detail that should catch your eye. The paperwork pipes are growing faster than the money pipes. So, let's do it. Let's put $1 into this machine, your dollar, and ride with it all the way to the end. Here it is, $1, leaving your paycheck on a Friday. It doesn't go to a doctor. It goes first to your employer's benefits department, which sends it, bundled with millions of others, to an insurer, where it lands in a vast pool, waiting. Months later, you actually get sick. You see a doctor for 11 minutes, and now your dollar has to find its way back to her. And this is where the journey truly begins. The visit becomes codes. The codes become a claim. The claim travels to a clearinghouse, is checked, reformatted, and forwarded. At the insurer, it enters adjudication, a gauntlet of automated gates, each one asking, covered, coded correctly, authorized in advance, medically necessary according to our rules, and at any gate the claim can bounce. Roughly 1 in 5 claims hits a wall on the first try. Denied. Back it goes, rework, appeal, resubmit. Weeks pass, sometimes months. The dollar waits in the pool while people argue about the paperwork describing it. Then, one day, approved. The dollar moves at last, minus the toll of every hand it passed through. Because here's the arithmetic of the journey. Depending on what researchers count, administration consumes a significant share of every American healthcare dollar, far more than in comparable systems. The journey itself has a price. Your dollar left home whole. It arrives at the clinic worn thin, and the strangest part, you'd expect someone to be furious about this, some customer somewhere, demanding better. Except, look around. Do you see a customer anywhere in this machine? Because that's the real discovery down here. Healthcare has customers, but no single person performs the whole job of one. You, the patient, choose the care. But you don't pay the bill. Your insurer pays the bill, but it doesn't choose the care. The doctor provides the care, but she often doesn't set the real price. That was negotiated in private long before you walked in. The one who chooses doesn't pay. The one who pays doesn't choose. And the one who provides often doesn't set the price. No single person anywhere in this $5 trillion machine is doing the one job that, in every other market, keeps prices honest: shopping. Try to imagine any other market working this way. A supermarket where you fill your cart blindfolded, someone you've never met pays at a register you never see, and the price is revealed to all of you 4 months later. Would anyone compare prices? Would prices even mean anything? That's why the same scan costs 5 times more across town. Not corruption, not conspiracy. Prices in healthcare have simply lost gravity. There is no customer to pull them down. In every other industry, that pressure, millions of people checking prices, is the invisible force that keeps machines lean. This machine grew up without it, so the parts that get rewarded aren't the parts that make care cheaper. They're the parts that win the paperwork. And when winning the paperwork is what pays, you get an arms race. Watch both sides of the machine, because both are behaving rationally. A payer controls costs the only way it structurally can, by scrutinizing claims, more review, more prior authorization, permission before treating, more denials. So the providers respond the only way they can. They staff up billing departments, coding specialists, denial management teams. One famous American hospital was found to employ more billing clerks than it had beds. Doctors' offices now report spending a dozen or more hours a week just seeking permission, hours that used to be patient care. And so the payer hires more reviewers, and the provider hires more billers, and the payer upgrades its gates, and the provider hires consultants who specialize in the gates. 2 armies, growing every year, funded by the same healthcare dollar, each one existing chiefly to fight the other. Since the 1970s, the number of physicians in America has grown steadily. The number of healthcare administrators has grown many times faster. None of these people are villains. Every hire on both sides was a reasonable response to the other side's last reasonable move. But notice what the machine's fastest growing parts have in common. They produce no care at all. They produce motion. So the obvious question, the one you've been shouting for 2 chapters now, why doesn't somebody just simplify it? Come close to one of the valves and you'll see why. There's a person there, a decent person with a mortgage and a family, doing their job well. And their job is the valve. Administrative complexity in American healthcare is estimated to consume hundreds of billions of dollars every year. But a dollar of waste is never just waste. It's somebody's salary. Millions of somebodies, coders, billers, reviewers, negotiators, processors, an entire profession on each side of every checkpoint. And here is the part that outsiders always miss, because it's not that these millions of people are guarding their jobs. It's what their jobs are attached to. Once every hospital and every insurer has built its teams, its software, its contracts, its workflows around the complexity, simplification stops being a single decision. It becomes a coordinated migration that nobody can complete alone. A hospital can't abandon the codes while every payer still requires them. A payer can't tear out its gates while every claim still arrives needing them. Everyone would have to move at once, and there is no one who can tell everyone to move. Nobody at any valve is doing anything wrong. Nothing at any valve is even broken. The machine isn't held in place by malice or even by fear. It's held in place by interdependence. 10,000 organizations, each unable to change until the others do. Nobody designed the money machine, but by now the money machine employs everyone who could redesign it, which leaves one last thing to see. The thing this journey has actually been costing us. And for that, we have to follow the dollar to the very, very end of the line. Rise up, all the way up. There it is, the whole machine at once, the thing that's been underneath every hospital, every pharmacy, every bill, this entire time. It was never one building's fault. It was the root. In 1960, patients paid much more of their medical spending directly. Today, most money reaches care through employers, insurers, or government programs. That protects families from catastrophic bills, but it also means the person receiving the care rarely sees the negotiated price. The person paying rarely chooses the treatment, and the provider often operates inside thousands of payment rules. The price of healthcare is not merely the cost of care, it is also the cost of coordinating who receives it, who approves it, who prices it, and who pays. And this is bigger than America. Every country on earth runs a money machine. Every one of them routes the dollar differently. Some routes are short, some are long. And you can read any country's healthcare bill like a map. It is a portrait of the path its money takes. But before we go, follow your dollar the last few feet, past the final gate, out of the last pipe, thinner than it started. But it made it, into a hand, a nurse's hand, holding a patient's hand. Because at the very end of every route, past all of it, the machine disappears and healthcare becomes what it was in 1955, what it has always been. One person caring for another. Care became more capable, more complex, and often more expensive. But America also built an unusually expensive journey around it. So the next time you're holding a bill, nobody can explain. You're not reading a price, you're reading an itinerary. Stop staring at the bill, follow the money, and you're seeing the big picture.